you tell us about polycystic kidney disease?
Polycystic kidney disease is a range of conditions that cause kidney failure and sometimes liver failure. They're inherited and incurable, and they affect up to about 12.5 million people in the world, about 70,000 in the UK. But the type of polycystic kidney disease that Aaron had was a very rare form. It's called a recessive condition. And that comes about because the two parents of Aaron, in this case, carry a mutation in their genes. They themselves don't suffer from the condition, but when they have a baby, when the baby is conceived, there's a 1 in 4 chance that two of those genes come together and the poor child that inherits those genes has the condition. Sadly, with polycystic kidney disease of the very rare type, about 1/3 of babies who are conceived die before they're born. And a number of them, unfortunately, don't survive the day they're born because their kidneys become very large and cystic, almost the size of their tummies. And that squeezes their lungs and they can't breathe very well. And I think that's what happened to Aaron in his early days. But he went on to survive for about 14 months until, sadly, it overwhelmed him as well. The babies that do survive, some of them do quite well until they're a couple of years old, and then they might have to have dialysis because their kidneys have completely failed, and usually go on to have a kidney transplant, often from a parent. In some other rare cases, they can also have liver complications, and so quite a number of them have combined liver and kidney transplants. So this can be all under the age of 10, from 2.5 up till 10. So you can see their lives are affected from a very early age, and sadly some of them don't survive to full adulthood because their kidney might not last forever and their liver might not last forever. And if they don't get another transplant, sadly they will die.
So can you tell us about your connection with polycystic kidney disease and why you do all you do for the charity?
I was born with polycystic kidney disease, but I was born with the less rare form of it. I was one of 4 children of 6 born with the condition, and my father had the condition and he inherited it from his mother, who died when he was only 3. He was an orphan, and he died in his 50s from complications of polycystic kidney disease. And I'm one of 4, as I said, and my kidneys are failing, but I don't have as many complications as some people with the condition. I have 2 sisters and a brother. Sadly, one of my sisters died just 2 years ago after having had a transplant and been on dialysis for 10 or 12 years. And she was very ill at the end and sadly passed away following a comatose state. My younger sister, who's 4 years younger than me, had a transplant last year, which has been very successful for her. And our younger brother is doing okay, but has got some failing kidneys. So that's how I come to know so much about the condition and why I'm passionate about supporting people with it, because I've been through it and I've experienced it myself at a very individual level, but also through my family experiences. And so I give my time to support others with PKD. The charity receives no money from the government or any other sources than individual donations. And sadly, a lot of the money I receive is from funerals and from people who died of polycystic kidney disease. And sometimes it's a handwritten letter with a little story about that individual and a cheque to help the charity's work. And that's how we get our funding, and we're so grateful to the families who choose to donate in memory of bereaved relatives. Otherwise, we have lots of people doing marathons and baking cakes and doing dress down days and jazz nights and companion dog shows and all sorts of small to large fundraising events. We also receive donations from the Aaron Brown Rainbow Foundation, who very kindly give money every year to help us put on an event for the families and the children who are affected by polycystic kidney disease, the type that Aaron suffered from. So that enables us to pay for a creche and give the kids a nice day out, whilst parents can sit separately with the experts and listen to the latest on polycystic kidney disease, and also share their experiences with other parents and not have to worry about the children. So we're very grateful to foundations such as the Aaron Brown Rainbow Foundation for supporting us in that way.
So tell me, Tess, how did we meet? Would you like to share with everyone?
I met you on the phone around about the time that your nephew Aaron was born in Scotland. I think it was your mother, Alana, who rang me first, followed by you, to tell me that out of the blue, all of a sudden, this baby had been born to your brother and his girlfriend, and it was polycystic kidney disease, and you knew nothing about it, which was understandable because of the type of condition that it is. So that's when we met, and I guess we formed a bit of a friendship then, because you contacted me a few times afterwards, and then especially after Aaron had died and you'd set up the Rainbow Foundation in his honour and his memory, you contacted me again to tell me what you were doing with the foundation and that you wanted to support our charity, to support other families who are going through the same emotional roller coaster and sometimes short lives that Aaron had gone through.
Tell us about the charity, the Polycystic Kidney Disease charity.
I run the Polycystic Kidney Disease charity, which was set up just over 10 years ago to support the families and individuals who are affected by polycystic kidney disease, the rare one and also a slightly more common version of polycystic kidney disease. I run it now. I was a volunteer. I joined about 8 years ago and then became the chair, and now I manage the charity along with a part-time fundraiser. So what we do is we support families and individuals, and that means sometimes speaking to people on the phone who ring up in distress, like your mum and yourself did. Or it might be somebody who's been to the doctor and just got a diagnosis and wants to know more. Or it might be somebody who's feeling really upset that they have this condition which could end in kidney failure and sometimes liver failure, and have nowhere to go and talk to just have somebody who will listen to their concerns. Sometimes the psychological and emotional side of a kidney disease that's incurable and long-term and progressive and chronic can be more destructive than the physical aspects of the condition. So the charity offers personal support. We have lots of Facebook forums and groups, and we run education days around the UK where patients and families can come together and share their experiences and meet other people who have the same condition and feel less isolated and less alone. We also raise money for research because there's not a lot of research into this condition, and as I said, there's no cure. So we're hopeful that in the near future there may be some therapies developed that will at least slow down the progression and allow people to have a near normal life, even if it's not cured itself. And we also do fundraising for awareness generation and get publicity.